Okay, welcome to episode 35 of the Sean McGinnis podcast. Today we have Dr. Fionnula McHale. Absolute pleasure to get her on because I've been following her work for years. So, aside from the introduction, Fionnula, what research kind of has tickled your fancy lately, or what areas are you looking at?
I suppose the focus of my research or like with stuff that I look into a lot, Sean, would be a lot of the microbiome stuff. So that I guess features largely not only I suppose my own general interest, but also I suppose in clinical practice. And the reason being is the microbiome, I suppose, as we see, we've got a lot of the research coming out and a lot of the the top researchers, I suppose, in the field are now denoting the microbiome as another human organ because it has such a substantial role to play not only in terms of how the gut works, but how all of those other things that we know the gut affects is regulated by the microbiome. So I
Yeah,
suppose that's really where a lot of it is centered, to be honest. Now, don't get me wrong, I tend to have a general interest in human health anyways.
yeah,
But I suppose it's just such exciting research, not only, I suppose, for the stuff that's coming out and shows such an important role it has to play, but I suppose for my own sake, because I've been doing it in clinical practice for 10 years. And, with the benefit of stool testing, now we see, in the past, when I started out at the start, I was doing a lot of stool testing, seeing a lot of stuff come back, intervening with bits and pieces, and just seeing so many other things improve for people when they address the gut. That, there's stuff coming out now that I would have already seen in clinical practice for so long. So it's nice for me now to see that the data is there, which is fascinating really for me. Like I've always had a science background, but when we see the real molecular stuff coming into fruition in the human, I think it's amazing.
yeah. I think I kind of heard of it even when I was starting off as a PT. It must be 10 years ago. At this stage, where people obviously talking about the vagus nerve and your neurotransmitters, and then a lot of like traditional Western medicine at the time, like, don't worry about that. Like, that's
Well, they
at the
still say
time it
that
probably wasn't
to
as science driven. And obviously, like you talk about, it's a big player in whatever, from skin disorders to mental health, etc. But one question I did want to ask, and I don't think it's as well known, what is the role of women that have C-sections for kids, and what's this kind of science with that, and the gut flora, and how does that play a role?
Yeah, I suppose when we look at C-sections, remember the baby doesn't pass through the vaginal canal. And I suppose that's why we see so many babies who are born by C-section run into problems later in life or even in the early stages of life with things like repeated infections, allergies, autoimmune diseases. And, the typical case of IBS starting earlier in life, never really getting resolved or never taken seriously by conventional medicine, and that progressing into other things, like I said, how the gut is going to affect the immune system, which applies not only to susceptibility to infection but also to autoimmune diseases. And remember, the consequence on the immune disruption as a consequence of dysbiosis is going to have an impact on the mood state. So any inflammatory state is going to affect the brain, even if it's coming from the gut. But also, I suppose, as you mentioned yourself, the role of the microbiome in shaping the neurotransmitters in the brain, those neurotransmitters being responsible for mood, cognition, and behavior. So it's often very hard for people to conceptualize, okay, even in my practice, like I'll ask people, okay, take me back to birth and talk me through where we're at today. And obviously things that are relevant, I say to people, are the medical history, which, admittedly is easily documented on the form. In 2002, I had IBS, I went to the GP and they gave me whatever they gave. And then in 2004, I had a appendectomy or whatever it happens to be, they're easy to put on a form. But what I like people to talk me through as well is stresses, traumas, major life events. And I suppose when we look at a whole case of a person, it's not just their symptoms, not just their disease diagnosis, but the whole person, we start to see things. And I suppose by virtue of me doing non-practice for so many years, when we look back and it's a very common history where the child is either born by C-section or let's say they were premature and they run into they've been in an incubator or whatever it happens to be. That birth history is very central to what goes on later in life for the person. So, like I said, if we pass the ideal circumstances, we have a normal full-term birth, we pass through the vaginal canal, and as we do, we contract the microbiome from the vaginal microbiome. But also, actually, there was some literature I was reading lately, and it shows the role of, I suppose, the mother's gut microbiome and how that has an impact on a placenta, and that too can have an impact. Remember, we don't just have a microbiome in the gut, we also have it in the skin, the vagina, and the oral mucosa, and people often forget that. But I suppose that passage through the vaginal canal is so central. And I think there was a study a few years ago, Switzerland or South America, maybe there was the two. It's a long time now since I read it, so don't quote me on the intricacies of it. But I suppose what they were doing really was they were putting a swab in the mother's vagina, and you probably heard of the bit yourself, and then they pass it over the child. So at least they're getting some amount of fluor there directly from the mother. And remember, the other factor as well in that is breastfeeding. So the importance of breastfeeding, particularly in a child is formed by C-section.
So yeah, because it's funny, because even I don't know, me and my partner are kind of at the stage now. We just looking at different things, and you see people have C-sections, and only we're in the health industry that we would even talk about that or hear about it. Why do you think it's not as prevalent, like when people are weighing up the options, whether to have it, whether to have natural birth? Why is no one talking about it?
Yeah, I suppose there's a lot of things that they don't talk about in conventional
Yeah.
medicine. I suppose for your listeners, my background is conventional medicine. I went through that system, and that's why I don't practice in that regard anymore, because of my own health issues and seeing if this clearly isn't working. Don't get me wrong, it's great in the context of acute illness, but when we look at more chronic diseases, there's such a large gap there between like what the GP can actually do. But I suppose whether it's you're talking about C-section and its role in human health, or you're talking about the role of the gut, or even at a very, very, very simple level, if we look at today's crisis with the COVID, everyone talking about a vaccine, but I don't hear anybody talking about like metabolic health. Like for me, like I said, I obviously have to be very careful with what I say here in this regard. But the reality is, like, if we look at the comorbidities that are associated with disease from the COVID, the coronavirus, like we really want to look at metabolic health. What's the biggest parameter? What's the biggest thing that people do each and every day, 3 times a day, that affects metabolic health in a profound way? And that's the food. So and also we look at what's being imposed on us in terms of a lockdown or a quarantine. Lack of sunlight is going to affect, obviously, vitamin D, and also have an impact on the mood. Not just from the light's effect on the vitamin D levels, but often people forget the role of the light in terms of how it shapes the brain biochemistry. So, even if we look at things like seasonal affective disorder, just taking a vitamin D tablet isn't going to solve the problem. It's the light that we're exposed through the eye, how that affects a little pigment called melanopsin, and that in itself shapes the brain in terms of cognition in particular, but also mood. So I guess to answer your question, I know I've probably gone off track a little bit there, but there's a lot of things in conventional medicine that they don't talk about. That doesn't mean that they will often come back and say, "Oh, there's no research," but like there is. You're just looking in the wrong place, and I know that from my own experience, and I understand it. It's not that they don't want to, but if you're in that, let's say you're in the field in conventional medicine, you choose a field. You pick dermatology, you pick gastroenterology, and your focus in the literature is focused on that area. And also, I suppose a lot of it is coming from drug companies and education. Like, when I was in medical school, I'd say we spent maybe 2 hours talking about nutrition,
Yes.
which is such a fundamental role for health and optimizing health, but also in the prevention of chronic diseases. So, the education, we only look. It's like you've done a degree in psychology, and they always say, like, if you start to notice something, you see it all the time. If you're not aware of it, you don't see it. So there's an awareness thing there too. Like, that's not. Remember, the other thing I always say as well, we look at conventional medicine. Like in the past, particularly in Ireland, the doctor is held in such high regard. They're like the gods. Like, that has dissipated to an extent with the internet and access to information. But the reality is that, like, there's so many other things that affect health besides just taking a medication. Like I say to anybody else, depression, you don't develop a disease because you don't have a drug. It's not a deficiency of the drug that treats the disease. Where did this disease come from in the first place? Like, that's okay. Don't be wrong. There's certain genetic diseases, yeah. But equally, if we look at genetics, we can shape the genes by virtue of our lifestyle. The drug doesn't help that in any way. So it's being able to understand the role of our lifestyle, what we do every single day, whether it's the food that we eat, which is obviously something that we do regularly every single day, how we eat, the timing that we eat, our exposure to light, exercise, little things like cold showers can have a big impact, our exposure to nature. All of those things do have a very central role on health. And I suppose that's not always talked about in the conventional role. The focus is largely on drug therapy.
Yeah, and that's a big frustration for, I think, I don't know, a lot of trainers or people that want to help their family and may have a parents coming from that generation where the doctor is kind of like the priest in the area. That's the and
That's the
you
truth of it.
you may say something and go, probably should eat a few more veggies. The doctor didn't say that. You're not a doctor, like relax. And
I know, and it becomes problematic, I guess, because obviously I see it a lot because I tend to, obviously I have a personal trainer and coach, and I get a lot of referrals from them because they know that I'm not going to I'm not going to just take 10-minute consult and give them a drug. It's not the way I work, never has been.
mhm.
But it's difficult. I think the traditional medical field doesn't have the same respect that it should for personal trainers, in the sense that like they're in such a crucial role to shape the person's health, shape their behavior, and also shape their mentality when it comes to health. If we place more importance on the people who are there, remember, you're training a client, you're not training them once a week, you're training them usually multiple times a day, you're following up with them all the time, how are you getting on? So you're close proximity to them, more so than I am, admittedly, as well. And so you have such a fundamental role there in their behaviors. And oftentimes, like I see it, like my personal trainer said to me this, but I went to GP and they said there was no impact of the food on what's going on with me. I'm like, okay, I just say you don't know. Like that would be my thoughts, because like you can't comment on something that you have no understanding of. Either you don't know the research and you don't know the clinical practice of it either. So if it were me, like personal trainers, our coaches, our nutritional professions, and functional medicine people as well, whether the doctor or not, you don't necessarily have to have a medical degree to do so. Like they're health professionals. The GP, the consultant gastroenterologist, whatever, they're disease professionals, as I would say. There's a big difference between people who are in the hospitals. They are focused on the person is really, really sick. They need this acute management, and that's where those people fit in, because they manage that disease, because the person is already at the situation where they have this active disease states, probably multiple things going on in the body, and yeah, they need to be managed so that they don't die. However, like in the ideal circumstance, if we look at the way the world is going and like the consequences economically and everything else, like from this major shutdown, like we have to look at, okay, well, like what we're doing in our lives actually isn't working. So, come back to basics and look at the people who are in that very important position to be able to exact changes in people's behaviors, in their education too.
Yeah, and
Because what is the worst thing that happens? Yeah, if the client, let's say they're doing really well, they're losing weight, they're, a lot of other things change. As you know, a person comes to you for fat loss, usually you're changing their body, but a lot of other things change for them. Their mood is better, their sleep is better, their energy is better, and they lose weight as well. So, and then they go to GP and you say, oh, that's not actually having any impact on you. Okay, like, really? And then there's doubt comes in the mind of the person, and they're like, oh, and the doctor said this, that what you're doing isn't having any impact. So
yeah,
that's frustrating for people. That's probably gone off on a totally different topic.
no, that's good. Over here, it's actually I'm in the Sydney CBD, so it's changing a little bit. More people like yourself that are getting that holistic, and there's actually holistic practices popping up everywhere now, which is brilliant in the city, because obviously people, when they're more into their health, they're looking towards that. But going back to kind of the more traditional, like you said, I did a degree in psychology, and only from just me being interested in doing my PT and going towards that health side of it. Never did we hear about anything when it comes to food or like neurotransmitters in the gut, etc. So someone goes in now and they might go into the doctor and say, I'm a bit sad or mood disorders. And I think I seen something on your Instagram where the rate of SSRIs and people taking stuff like that has gone through the roof. How or what, like, why is it first so easily given out, and kind of what are potential dangers, whether it's the tolerance of taking these drugs over time that you see?
Well, for one, short, like what I say to everybody else, remember, like the cause of one, let's say we take depression. The cause of one person's depression may be very different from someone else, which may be very different from someone else. The literature for a long time focused on serotonin, and that was the only thing that affected it. So, everybody who experiences mood disorder, which bear in mind the diagnosis is based off, the DSM. So that's not a scientific test. That's just a book that says if you tick all these boxes, you have depression. And so when we really look down at it, there's many different causes, and we're looking at the pathogenesis of depression. For some people, it may be, a few things that in most cases of depression are quite complex. As you know, in the case of mood disorder, there's always going to be the psychological component. There's probably something that's happened to them, whether they remember it or not. Now, obviously, nutrition is going to have a major impact, particularly on the symptomatology, what's going on with the gut microbiome, what's going on with the hormones. Those are all, I suppose, the physiological or biochemical things that can contribute to depression. Simple nutritional deficiencies can also cause a mood state, or an altered mood state. But I suppose to answer your question, when we're talking about the cases of depression and the SSRIs, remember, if this person might not have any issue with serotonin, maybe it's their dopamine. That's why now I suppose we do see other medications, bupropion, things like that target more dopamine factors. But the risks of those medication is well documented in the side effect profile. For one, as you said, tolerance. So what happens over time? Yeah, they might feel good initially for the first 12 weeks, and then they're so obsessed with this tablet is making them better. And then what happens over time? Oh, it's not working anymore. So what's the approach? Increase the dose. Because it's like caffeine. If we take coffee, we never had it before in our life, and we have one cup of coffee, it's like, whoa, this is amazing. But what happens over time? We keep drinking it then because we think it's so great. But then we're like, okay, well, I'm not getting my boost now today, so I'm going to have more. And what is the approach realistically? Because the receptors are so used to having that stimulation there. It's not just, I suppose, dopamine, which most people consider, but also the impact on adenosine. With time, obviously, the only way to get that first high back, as it were, would be to cut it out. So, the antidepressants, SSRI or SNRI, work in a similar way pharmacologically. And so, over time, the thing isn't going to get any better. If we really look at the trials, I suppose the people who do best, and don't get me wrong, there's only about 60% of people with depressive symptoms that respond to mood disorder. So what's happening to the rest of them? But in any case, the people who get the best results are those who do psychotherapy and SSRI. And if we really look at it, right, they say, oh, if you take this SSRI, it's not going to have any impact until 2 weeks. That's true. But if we look at it pharmacologically, if we measure, if they did studies where they check the CSF and everything else, the pharmacological effect of that drug is evident immediately. So is it really the drug, or is it the psychotherapy? Mm-hmm. We need to look at it more objectively, and also the role of placebo effect. So first of all, finding don't get me wrong, there are times when people may need to take medication, but I wouldn't be an advocate for long-term therapy. So let's say someone is very unwell, they're in a psychotic state, which, remember, if you have depression, and it gets so bad, yeah, of course you can get in a psychotic state, and yeah, you might need to take an antipsychotic. Again, it's not the most ideal drug, but it stops you killing yourself, stops self-harm, stops from going to recreational drugs, which is just as bad. Because although it might give you temporary relief, if you're feeling psychotic and you have a drink, it's probably going to make it. It might calm you, depending on the type, obviously. But any recreational drug, you can understand how people go to it for self-medication, because someone's depressed and they try cocaine. Yeah, it's going to be hard to stop that because they're probably depressed their whole life. And yeah, it offers relief, and the nature of the drug makes you convinced that, okay, this is the only thing that's helping me my whole life. So same thing if someone's anxious, of course they're going to go to alcohol, because alcohol's going to calm them down for a while, and that would be very difficult to stop if, say, the circumstance. For a lot of people, maybe not so much anymore. I think we've gone the opposite way, where there's overprescription of drugs. But in the past, nobody understands it. Okay, this person's just a bit sad, or maybe they just, it's all in their head type thing approach. But if we look at it now, I would agree that there's an overprescription of medication, and although it has certainly alleviated the stigma to somewhat, particularly in depressions and anxiety, not so much maybe in other areas of psychiatry. But if we look at depression and anxiety, nowadays everybody uses the words, I'm depressed, oh, I'm anxious. Remember, at the end of the day, there's a big difference between being sad because something happened, or being sad because we're in lockdown and can't see my friends, or being anxious because there's so much uncertainty in the world. Those are normal emotions that every human goes through in life. You know, we're not supposed to be happy and full of the joys of life every freaking day of our entire life. Emotions are a normal part of life. Big difference in that versus having depressive disorder, which, as many people forget, is not, for most people who have major mood disorder, it's not just being sad. Most of the time, and I know it from my own experience, is feeling nothing. And it's not just the mood that is affected, it affects the entire body, because everything from the neck down is controlled by the brain. So even if it's going to affect the training, it's not that there's no muscle there. It's not as if they're not strong relatively. It's not as if they haven't had enough food. Like, the brain just isn't sending those messages to be able to contract. So the person can be depressed. One day they lift like a 1RM 100 kilo squat, and the next day it's like 20 kilos, empty bars, to struggle. That's nothing to do with like metabolic resources or anything like that. It's a depressed mood state. It's the same thing with generalized anxiety disorder. You know, if I have to go give a speech, I'll use my own example. If I have to go give a lecture in public, I have been doing that, like public speaking, since I'm like 12, younger, 10. I still get a bit anxious, you know, like I'd be a bit nervous, oh, I'm going to do it right. All these things go to my head, but it doesn't inhibit me from doing it. So no matter, like, anxiety is normal, or if we're getting married, for example, or, you know, there's a big life change, it's normal to feel worried or anxious. Where it becomes problematic is where it inhibits our ability to do daily activities like leave the house, or to do that thing, you know, my heart is beating, I'm sweating, and I can't get any words out. That's a disease state, you know, whereas to feel a bit anxious is normal, you know. And I think nowadays, because so many people are like, oh, I read about anxiety, this is anxiety now, so I go to the doctor and get the Xanax. That, for one, is a terrible approach, because that, like, obviously benzos and addiction is just major. I personally don't believe they should ever be prescribed. Don't get me wrong, there's a role for medication in the short term, but you know, like, just because somebody's anxious about the uncertainty in the world around coronavirus doesn't warrant an SNRI or an antipsychotic, or even the cases now we see sleep disorders, you know, like Seroquel for sleep problems. Like, why like, you know, like, there's so many other things that are going to affect sleep, from, you know, like how much caffeine we have in a day, from magnesium, glycine, all these things that don't come with like the side effective profile of a heavy antipsychotic to make someone sleep. You know, you really need to, like, my personal opinion would be to reevaluate that pattern. But even hypnotics are going to come with a problem. So if we get used to like zolpidem or zolpidem hypnotics, like, they're so addictive, first of all, not only because of its pharmacological role, but also in the psychological aspect. So I'm not going to sleep until I take my 10 milligrams of still locked, or whatever it is. And every night then we're like, oh, what if they run out of the medications? Like, panic, you know, and where's my thing? And we have to get, like I said, sleep disorders are so common at the moment. But if we look realistically, like, most people, if they have one bad night's sleep, they sleep again the next day. Or if they another one in a row, the next day they sleep. There's so much focus, I think, on all these things sometimes that we overanalyze them, and they become more problematic. And again, the natural habit is, oh, just take a tablet for this. I have a problem with sleep last week. Oh, I go to the GP and get a sleeping tablet, you know, or like this, I had a divorce. Don't be wrong, I'm not downplaying those situations. What I'm saying is, I think as a culture, we've gotten so used to, this is unpleasant, I need to take something for this. And that behavior is not good. And it's encouraged, I think, by the conventional medicine system, you know, rather than, okay, I'm stressed here now, or like this is a major impact on my life. I need to maybe breathe for a starter, you know, simple things like this mentioned earlier, the cold shower, meditation, all of those things. And yes, they are difficult when you're in the height of it with anxiety, in the middle of a panic attack. Yeah, of course, it's difficult to sit down and breathe and do nothing, or to go have a shower. But if you keep doing that repeatedly, A, you won't experience the same heightened state of emotions, and two, you get used to dealing with it for inherent therapy. Simply like go for a walk out in nature. Who cares if it's pissing rain, which it is in Ireland most of the time, but you will still feel better, you know. And all of those things are tools that we need to build up, I think, for most people. And don't get me wrong, I'm saying this from my own experience too. I've learned these things over the years. But I think if people were to, if there was more, it's not general public's fault. it's the education that they're receiving from the mainstream media, I think,
Yeah, and like you said, when obviously social media is great in the awareness of our mental health for depression, anxiety, but like you said, it's thrown around. I know people don't understand the actual clinical, some of the symptoms of actual depression. They wouldn't be throwing it around as much. And how do you kind of, I would tell people to differentiate, same anxiety, and obviously it's a continuum, but maybe you're not depressed, you just don't eat good, or don't train, you don't sleep, and then you just drink on the weekends. Of course you're not going to feel good mentally.
Yeah, well, don't get me wrong. Like, I know from my own experience that, like, I lived with depression most of my life, short of the last 3 years. And I was on the Trinity Psychiatry debating team. I was on the mental health public speaking team in secondary school. So I knew all about psychiatry and mental health and what depression means. And yet still I had no insight into my own condition until I got to the point where I made a fairly major suicide attempt. It was only by chance that I was found. So at that point I was like, I had to go to treatment. And all of a sudden I realized, oh, it's not actually normal to think about dying in the morning time. I'm not making fun of it now at the moment. Like I mean, I'm laughing really at myself and my own ignorance until I suppose show compassion to those who are suffering. If we've suffered for such a long time, how do we know it's not right? My circumstance, I suppose, wasn't ideal in the sense that, like, I did go to doctors, but they weren't in any way helpful in that regard, and I would hope that nobody has to go through that experience. And so, there's a big difference between when we're looking at the difference and how to differentiate if you're at home. If you're sad for a few days because somebody passed away, because something happened with a boyfriend, that's normal. But if it's prolonged, if you're starting not to enjoy the things that you would usually enjoy, like I said, usually 14 days is the category, and probably longer, really. And lack of interest in things you do. They look at the basic factors. Are you eating? Now, remember, they often say in the case of depression, not eating. But for other people, it can be over consuming food. So it depends on what's the biochemical picture of the depressed food state. So, like I said, there's an issue with the dopamine, the serotonin, whatever it happens to be. Some people will undereat, some people will overeat. If somebody's not like, if social engagement. Now, remember, we're in COVID situation here anyways, and we're in lockdown, so it wouldn't be unusual, or you're not really permitted to engage. But like, let's say somebody's not responding to messages, things like that. I suppose whether I would have always noticed it in my own case. Like, just getting back to messages was like a major chore. Like, it wasn't anything personal towards to the people. It's just like the effort of having to think of what to say to this person was just like too much. So those things, I suppose, would be noticeable. Libido, also a big thing. So there's no interest. Like I said, that's one of the basic things that a human being should experience. You should want to, interact sexually with another human. That's part of the human species. So if there's an issue there, sleep, again, like I said, sleeping too much or sleeping too little. Like, so it's not a cut and dry diagnosis of like, okay, well, I'm actually sleeping too little, so I'm not depressed, But when it impacts all of those key health issues or parameters rather, that's when I would be thinking, okay, maybe I need to go see someone now about this. Or it's like, it's going on for a long time.
Yeah, and the same with anxiety, like you said, it's a continuum, and I think a lot of people mix up, like you said, just worrying and anxiety. Where does it fall into, like, where people are just chronically stressed, and those kind of symptoms are rearing their head as anxiety or depression? Because I know, just from having that self-awareness and going for like panic attack before, I know when I stress my body out too much, training, drinking too much coffee, not sleeping, I will get that will show up as anxiety in my case, in that regard.
Yeah, well, like, remember, at the end of the day, stress is going to appear as anxiety. Like, if we're highly stressed, it's going to display like anxiety. And some people will experience anxiety disorders as a result of stress. And equally, if someone has a history of anxiety and they have a high stress, that might spin them over or put them into the category of anxiety disorder. So when a few things come together. Um, but ultimately, anxiety disorder, obviously, panic attacks are usually a feature, but not always. And then I suppose with anxiety, if it's anxiety disorder, like, it's prolonged, and like I said, it's interfere with your ability to perform normal tasks. So people that are too anxious to go to work, they're too anxious to leave the house, and like I said, debilitating panic attacks. Like I said, that's a generalized anxiety disorder as such. Like, don't get me wrong, there's many different types of anxiety disorder, but to keep it simple, versus a stress reaction, like, person's not sleeping but they're still going. There's different personality types too that will cope different. Like for people who, let's say, have experienced high stress their full life, they often say, oh, I do better when I'm stressed, like I function better when I'm stressed. They drive with that. They often bring it about themselves. More coffee, more, keep going, doesn't matter if I don't sleep, like just keep going. Eventually, what funny enough happens, I often see it in practice, is people go through really high periods of stress and they're like, go. And then they interpret that they're coping very well. Then usually like a year later, depends, for some, it's different timeline for some people, but they'd often come in like, I don't understand, like when I was high stress, when I was under all that stress, like a few years ago, I was fine, but now I'm getting all these health issues because I don't have the stress anymore. And people are often very confused about that because, and the reality is, if we're in high stress, the adrenaline's going, and what is adrenaline? It's like a fight or flight hormone. So it's there to help us survive. By contrast, when that threat is gone, so there's no one checking up on us, nobody checking when is the email done, when is the product done, or whatever it happens to be, are you reaching the timeline, and then when it's finished, what's the next one? How much coffee and stimulants or whatever happens to be, and then boozing on the weekend, feeling shit, more coffee, that vicious cycle. When that stops and there's no persistent stress, let's say we've left that job or we've left that relationship, ultimately that's when the adrenaline is gone because there's no persistent stress. The cortisol's gone down through the dumps because it can't physically make anymore. That's when we start to experience the health issues, because we're not running on this adrenaline the whole time, wired to the moon.
But then I'll see people in the same situation as me, and obviously I know, okay, I just need to wind it down and add more kind of stress reducing stuff into my lifestyle, and that will control it itself. But then you'll see people in the same situation, like you said, go in and pop benzos and all these stuff to help them relax, when in turn they're just completely misdiagnosing what's actually going on.
Yeah, and it is, as you said yourself, self-awareness. I mean, I think, I can't discuss this topic without talking about the role of psychotherapy, and that's an invaluable tool, but equally I'm aware there's a high cost involved for people. So, I think having the awareness yourself of, okay, this is an anxious state, and what tools can I use at my disposal to, like I say to people, we can't always just quit a job. We can't always just, get more sleep, is maybe not like possible in terms of the lifestyle. But what we can do is, I always say to people with stress, what's going on with the sleep? How can we maximize the quality of it, even if we can't get more quantity? That in itself is going to have such a huge impact on the mood the next day, the energy next day, and thus the person's desire to want to, someone's stressed, they always feel tired, even though tired and wired is the usual experience, and they generally tend to be the people that are looking for some sort of stimulants, Red Bull, caffeine, to go. And obviously that's going to have a vicious cycle. They may need to do a few days of cold turkey at the weekend when they're not working, and go by that route would be beneficial for some. But I suppose looking at the sleep first and foremost, because of its pivotal role and impact in all parameters of health, I think that's always a good one for people. Supplementation obviously is going to be helpful, but more so, like I say to people, sleep, we can't just think about sleep when it comes to half an hour before we go to bed. Our whole day has to be thinking about being mindful, taking the time out. Okay, yeah, I get the time sparse for people, but if we're to take 5 minutes during the day, let's say even at lunchtime, 5 minutes of deep breathing. Like I say, sometimes I say to people, look, just go to the bathroom, put on the meditation app, the camera, the headspace, whatever happens to be, sit in the bathroom, because nobody's going to come near you when you're sitting in the bathroom. So, sometimes that 5 minutes during the day can just be a reset, breathe, relax, and then go back to whatever it is. Chances are you'll probably be more productive when you do go back, better able to cope with the environment. And again, be more mindful during the day. Okay, it's getting to 2 o'clock here. I'm feeling a bit anxious. So, maybe I need another 2 minutes to myself. If that means going to the bathroom so nobody can be near me, that's fine. But we can't just go all day long without breathing and then expect half an hour before we go to bed, even if we've had no stimulants, to be able to put the head down and go to sleep. It's just not going to be possible. You know, and I think that's something people forget too. It's like, oh, an hour before the sleep, I take my supplements, I'm going to go to bed, knock it out. Supplements, and taking a supplement and expecting not to exert the behavior as well is not much different in terms of a mindset than, okay, I take my still knocked and that will help me go to sleep.
So there's obviously a few other aspects of health that you make sure to add into your own lifestyle to keep everything going, your mental health, your physical health. I know you mentioned um cold water therapy, your dog. What other kind
Oh
of
my God.
aspects, maybe even looking out from a fitness perspective, such as like connection or like natural highs throughout the day, do you kind of think are overlooked, and the importance in a whole healthy person?
Absolutely. I think one of the biggest things really, Sean, and I know it myself from when I used to live in the city, was exposure to nature, you know, like whether it's just a park in the middle of the city, whether it's for me, like going by the sea. I like going barefoot on the sea, don't care how cold it is, like it's always cold here. But you know, simple things like that, and being able to appreciate those things, like being able to look at the sunrise and think, oh, that's beautiful, rather than like a million things going on in our head that are distracting us from the beauty. So for me, anyways, just being able to sit there, appreciate that, even if it's for 2 minutes, that makes me feel, as you said, that bit more whole and connected with the environment. So, you know, and I think if we can get barefoot at any stage is always beneficial for the grounding effect. Nature is definitely one. And I suppose, like, I obviously am a massive advocate for having a pet. Because she has had such a huge important aspect for me, obviously my experience. For anyone who doesn't know, obviously a very traumatic childhood, a lot of stuff going on there. And for me, I'd never experienced that kind of love as I do with Junior. You know, this little baby that like needs me. I'm her only thing, and no matter what mood state I am in, don't get me wrong, I'm being good now. The last year, thank God, after 3 years of recovery. But at the start, it wasn't easy. You know, I was on my own, didn't have anybody. Like so, you know, she was there, and she was an amazing support. Whether I'm happy, sad, having a panic attack, doesn't matter. You know, she's there. I do think pets, like even if there is plenty of literature, not only on the role of a pet for people with mental illness, but also because the pet has such huge impact on the microbiome too. So they did a study where they saw like people who sleep with their pets, they always have a better, a more diverse microbiome. So it's not just psychological, there's also hardcore physiological data. So obviously a pet, I think is huge. And it doesn't have, like I have another client actually, she would have suffered a similar kind of background to me in childhood, and she's a rabbit, you know, and for her that's her junior, like, you know. So pets I think are huge. They don't judge, they don't give a shit what you say or what you don't say. And obviously human connection is important too, but I'm mindful that not everybody has that luxury no more than I did myself. So you know, there's not everybody is going to have the compassion, the understanding, and the lack of judgment around somebody who's unwell. So, you know, like if you have someone like that, great, but you have to be careful too. In the sense that sometimes if you're very unwell, you don't always have the capacity to think rationally. And sometimes people who don't understand can say the wrong thing, not purposefully, but that could be very triggering for people. And I know that from my own experience too. It's no bad will on their part, but it can just be dangerous for some people. Like I said, some people are very lucky to have great family, and those people are very supportive to them. But to have the understanding that sometimes being on your own is the best case scenario if you want to stay well. Now, obviously, a therapist is going to be the most valuable too. So for me, like I still go to therapy every week. You know, I don't really suffer any issues anymore, thank God. But I still go because of how it affects me I go every week because I work with people too, as you know. So if you're working with people, and obviously the nature of my work, you're talking about some of the similar stuff that might trigger me. So my ability to maintain my own mental health from a preventive perspective at this point is so important as diet, as supplements, as exercise. You know, I think if we're looking at anything in the context of health, not just mental illness, but I think in overall health, we have to look at the whole paradigm. So the food is for somebody scientifically minded as well. And I'll say this again from my own experience. I like focused on the food because the vitamins and the minerals and the macronutrients and everything I can see on objective diagnostic tests. So I can test for my hormones, I can test for the gut, I can test for the vitamins, I can make sure all this stuff is perfect. But at the end of the day, unless I look at those things that are less tangible, less quantifiable or qualitative, those are probably the things that are going to have the biggest impact for me. Like it's easier for me to do diet, it's easier for me to do the supplements because I'm that way minded. But for me to kind of let go to therapy, talk to another human being, which for me was just a strange concept altogether, to trust another human being in this kind of way, that I say that in itself, aside from even the therapy aspect, has been huge. And the things like the nature, like just being able, like for me, I don't know that I was ever able to just sit there and look at the sunset and appreciate how beautiful it was. Um, Having junior, still nature, but like you said, those things I can't do a test for how much they've affected me. I can't assess what part of the brain they've affected. Maybe an MRI, I don't know. But like it's often the things that we neglect is what the things we need to do the most. It's like a training program, Like if I make my own training program, I'm probably just going to squat, bench, dead, really fucking heavy. Sorry for the language. But I probably need to do. Yeah, but I probably need to do the frickin' single leg exercises and the bloody glute bridges, So it's like if you want to get better at something, whether that's training or life, you're probably going to have to do the things you don't particularly like.
Yeah, I was going to say, you're not going to be doing split squats on your own.
Oh, no. But I do.
So within the therapy, and it's definitely obviously a big proponent because that's kind of what we learned in the field growing up. For people, now I know the system may not be helpful to people regards costs and Medicare, all that kind of stuff. Do you think that it's going in a way where therapy can be done online? Because I know there's a lot of CBT, that kind of therapy, or what's kind of your opinion on that? Or is it just the thing of connecting with someone and just physically talking can sometimes be the most beneficial?
I think, it's going to be very different for different people. On one hand, I'd be inclined to say, oh, I don't think the online is going to work. But at the same time, I try to think of different stages. Whenever I'm thinking of things like this, I'm like, okay, I've been through the worst of it. I really hope that most people never have to go through what I went through, but there are people out there. So, even sometimes just a text service might be helpful. Like someone who doesn't really know if there's something wrong or just somebody there, like I know there's been times for me when I just felt like there was just nobody, like, so maybe having had even someone that was like texting, there's a therapist, okay, I haven't heard from you in a while, what's going on? That in itself could be helpful for different people at different stages. Someone who doesn't inherently want to have to go into town to go to the therapist, like maybe having a video call would be helpful. And equally, remember on a video, there's always the mindset, okay, if I don't like this, I can just turn off the screen. And that I'm sure happens because actually my therapist told me that happened before. So, but at least they're there. That's what I would say. At least they're there. Maybe they go back to think about it. Oh, why did I not like what she was saying to me there? Or, I think any intervention with a therapist is going to be helpful for people so long as they're the right therapist for them. It's like personal trainers, like doctors, like any profession, there's good ones and there's bad ones. I think moving online is going to have a positive impact. Just in terms of the service provision, probably going to reduce the cost for people too. I know a friend of mine, Michael Garrett, is setting up, it's called Mind Clinic, and it's a whole online platform. And I think he has his own issues in that regard, as he talks about openly. But I think I think it is going to be a positive impact. It can't but be. And even like I say myself, like I personally prefer to see clients in person. There's that aspect that you can't really recreate sometimes on a screen. But look, COVID happened and the vast majority of my work now is online. And you get used to that too, even with my own therapist, I like going in. But look, if I wasn't in the country, do the video with them, so be it. Equally, maybe it's a case that we can do one session together, you get a feel for the person, and then you move online. I don't know, but I just think in any case where there's an extra service provision for people, whether that's a tech service or a video conference, as we're doing here, I think it would be positive in any case.
Yeah. And I think there's, like you said, the non-judgmental aspect can help for some people wherever they're at that moment of time.
The anonymity too.
Yeah.
And remember, like it's also the case of the fear of going to therapists. I think we also need to look at how it's going to affect younger people. So they're the people I think I really feel for because I was there. And when you're that age, and I know kids that I've seen through other people, I know they're suffering, but they don't understand what's going on for them. And I think maybe if it was more acceptable to do these things, like they would be more inclined to engage in it. You know, for younger people especially, they're all about their phones and the iPads and everything else. And we really need to look at people at that age, kids at that age who are struggling, because it isn't going to get any better for them, for the vast majority of them. If they're struggling with mental illness in those years, and they're going to end up with addiction, they're going to end up with eating disorders, so many problems that affect their life. Maybe not a diagnosis of mental illness, but how to even simple thing, how you interact with people, how relationships, the type of people that we go for, you know, and those things can have a very dramatic negative impact on us if they're not the right people. And we sometimes, you know, obviously the relationship we have with our parents often shapes what type of men or women we go for. So even at a very simple level, I think if it was more online, I think it would certainly help a certain proportion of people. Maybe not the older generation, granted, but I think younger people would subscribe to it far more than, you know, people obviously later in life.
Looking at brain chemicals, and you touched on people on the phone all these days. What do you think um is any future complications where we're in an age where you're posting on Instagram and you're getting all this dopamine hits from every like would it be the same as almost a seesaw effect where you can almost be coming down from all that likes and gratification after all that stuff going on?
No, I actually think social media, there's obviously huge positives to it, but well, I actually did a talk at the Swiss 2 years ago. I talked about this a little bit, but let's say, especially when we look at the filters and all these things, you know, if we take a picture and like we spend 20 minutes or probably longer, like doing the makeup in the morning, we got the hair done, you know, we dieted for 12 weeks, we got this really expensive outfit, and we take a perfectly posed picture in the mirror, selfie, or we get a photo shoot. Let's say we get 1,000 likes and normally we want to get 100. Like, what does that do for the person's reward system? Like, feeds into it. Okay, so now, like, I'm talking for a younger person, you know, that wouldn't understand these things. These are like subconscious things that occur. So did it get this reward, social reward? Or let's be honest. Like back in my day, we didn't have phones. You know, like, no, we didn't. Not to the same. It definitely was no social media. So you would get in person, physical like connection in that regard. There's no like thousands of people liking a photo, look like a photo. And nowadays, because we're so consumed on the phone, people don't talk. Like, you know, like I was actually talking to a guy in the gym, and he was like, nowadays, like people all talk messaging on Instagram, but like if you meet them in person, they don't even say hello, they're back on the phone. You know, like that for me is a strange concept. Like, you know, people are so brave on the social media, but I suppose if we think of how it affects the child's brain and how it's going to impact into their psyche and particularly the self-image. Also, then you add the fact this a filter. So they're going to say, okay, everybody thinks I'm great, everybody likes my photo and comments on how brilliant I am or how lovely I look when I do all these things. So that's going to make me think that for me to go out in public, I'm going to need to do all these things equally. Like I say to people, or especially kids, they look on their phone, they do the filter, and they look how amazing they look. Oh, it's like that's me. I look good, and I get all these likes. Then they go to the mirror in front of them, like, okay, I actually don't look like that. So what do I need to get done? I need to get the fillers. I need to get the Botox. I need to get the lips. I need to get the hairline change. I need all these things. So like you can see how that's not going to have a very positive impact. And don't get me wrong, some people are going to be more susceptible to these issues than others, but you can see how that is going to create a lot of issues for people, especially when there's no understanding. So whatever about they getting dolled up and do the photo shoot, I definitely want to be going and get a photo shoot, but I'm not going to think that the amount of work that goes into that photo shoot, sure as hell, you do that every single day. You know, even I would say in a funny sense, I'm like, geez, I don't know how some girls do the training and their hair is perfect and the makeup is perfect and there's no sweat. Like, look, if you see me, it looks like I just got out of bed. But look, I mean, like, some people are going to end up with more problems as a result of that type of feedback from the phone. And again, imagine how much that's going to affect to such a high incidence of suicide as it is. Of mood disorders. I suppose the WHO predicted, I think by, I can't remember what year it was, maybe it was next year, that depression or suicide actually among 15 to 21-year-olds, I think is one of the third leading causes of death in the moment, which is just like unbelievable to consider, you know.
Yeah, and even like you said, where we're not kind of comfortable in our own negative emotions, we're gonna pop a pill straight away. I think it's the same with our phones these days. We use that as a way of just getting out of any awkward situation. We don't learn to actually feel that emotion.
But it's that scrolling too, it's dissociative. You know, it's like people are looking for all these things to block the emotions. Like I say to people, the training is great, yeah, but for some people, it's like I actually said on a podcast during the week, you know, training should add to our life. We shouldn't need it. So like lockdown comes, you can't go to the gym. It's like, oh my God, what am I going to do? Like I need to get my fix, because what is the training doing? Okay, if you're in a bad state, it's blocking everything out. And don't get me wrong, that's great, but I wouldn't agree with the philosophy of training is my therapy. You know, if you need training to block shit out, what shit are you blocking out, and how best can you address that? Because what's going to happen over time, you're going to find other ways to dissociate. With a scroll on the phone, you're looking at nothing. Like I say to people, like, you sit to my brothers, what are you doing? Like, what are you doing on the phone? And you scroll. It just blocks everything out. You forget what you were thinking about, you know. And like I said, we want to be in a situation where we're present all day, where we're totally okay if we're happy and sad. Like I said, you know, last year Christmas, I remember very well, my therapist still brings it up, but I would say, you know, Christmas is a difficult time for me. I remember a lot of the bad stuff that would have happened for me, and don't get me wrong, I've gotten better, but last year I'd said to her, if I'm sad, and that's okay. I'm okay if I cry. You know, it's understandable that I will be sad. I don't need to go to the gym to block it out, but I might go to the gym to make me feel a little bit better after I have a cry. You know, so it's being comfortable in those emotions and not needing all these things to block them out, because okay, we might use scrolling on the phone, or we might use going to the gym, and we might use a food binge, but it becomes, especially for younger people, what's going to happen in later in life when they find weed, or they find cocaine, or they find alcohol? You know, they're going to be looking for more things to dissociate, you know, and unfortunately those things only work for a limited period of time. So if we do it one night, it has a great effect. The next time, not so much, so we need to take more. Same thing over time. We need more things to block it out.
Yeah, and I think I even read something about just Asian countries where they may not be as positive in the way they teach the kids. They teach them more about like negative emotions, whereas Western society, we never talk about the negative stuff. It should only
You're
be
right.
positive.
You're dead right. Like nobody really. It's like even if you look at social media, it's always, oh, this is my best. It's the best of everything. Like you know, like it's just rare that you see like people talk about the real shit that goes on in life. You know, because even like training, every day is not a great training day. Like sometimes you really don't want to get up and train, like, but you freaking do it anyways. Or some days you just can't. Like you know, that's okay. But you know, like, or you're not in shape, like no big deal. Like if not shredded, just locked into the world. Like, but I don't think we see enough of that online. And then sometimes what you do see is, you know, people who have a really big following, and let's say they're paid by a company because of like say they're sponsored by a clothing company, sportswear, and they're like a fitness influencer, and then it's depression week or whatever, have suicide awareness week, and they're on talking about the suicide week.
Yeah.
It's like, okay, or you know, that's you shouldn't really be talking about that. Like I get their intention is not bad, but it's not really coming from the right place. You know, like so like for me, if I was in that stage, let's say I was depressed and suicidal, and here's someone up there talking about like depression and suicide, I'd just be like, God, this is just gives me no hope in life. Like,
Yeah.
and I'm laughing, but I don't. The intention is not funny.
Yeah.
You know, very very serious effect, because I would just feel like God, like these people clearly don't know what they're talking about. So I'm just going to feel more lonely and more hopeless. You know,
Yeah, in
and
fairness, that's
that's
why I love all the podcasts and stuff we're on. We actually talk like real world, and that's why we're surprisingly refreshing in today's world, which is nuts.
yeah. It's
Um,
just, go
yeah,
ahead,
and
Zach.
the last question, kind of apart from the connection and the cold water and Juno, what is the other aspect of your health is obviously your career and your purpose. Kind of where do you see that going over the next few years, or how does that fulfill that extra piece of the puzzle in regards to your health?
Yeah, I mean, for me, obviously, like my career is something that is a part of me too. You know, like don't get me wrong, I wear the job and I see it as that, but to have that purpose, to have that passion, you know, I know for a fact that there's nothing else I'd rather be doing. And I think so many people, like, remember, we spend so much time in work that we have to have the passion for it. If you don't, like, what are you doing it for? Like, we all need money at the end of the day. I'm well aware of that. But like there has to be some enthusiasm and some passion there for what we do, because at the end of the day, even if it doesn't pay the same as something else that you're totally miserable with, you can't have a proper relationship because you're so stressed out with this job. You can't have the things that you want in life. Like, you know, then you're never not going to be happy. And if you're passionate about something, if you like, it's part of, like, it doesn't have to be, like, obviously my job is slightly different, but you know, if it's something that you really instinctively love, like you're going to be happier anyways, and you're going to be more successful at that type of approach, I believe. You know, obviously other people might have differences of opinion, but I would say from my own experience, like obviously I was in conventional medicine and I knew this wasn't for me. Did I have everybody on my back saying, like, you know, I was a high achiever. I worked only because I worked very hard. You know, like they always say, oh, I liked orthopedics. You know, that was kind of something I liked because the sports and everything else. You go, Fionnula, why wouldn't you just stay in orthopedics? You have a very good career trajectory. You know, SHO, Reg, consultant, a fairly stable pay packet. But you know, I just believed in myself that wasn't going to be it. And don't get me wrong, I didn't expect it to go where it is now. So I'm very grateful for that. But at the time, like, yeah, I worked night shifts in a hospital while I was doing this in the day. And yeah, there was a tough few years, but I knew in my heart, this is what I want. I knew I was going to end up with trouble with, you know, the powers that be in this arena. I still am. And yeah, that has caused a huge amount of stress, especially when I'm, you know, in a vulnerable period of recovery that has exacerbated those things. But look, at the situation I'm at now, as hard as it has been to A, recover from serious illness, to B, maintain the career, which, let's say, you know, wasn't conventional. I could have picked an easier route. Like, it has been worth it. And no matter what comes down the line, I don't have any regrets. Because at the end of the day, for me, I see the benefits every single day. I see people get better, people who thought they could never get better, and they come to me at the last hope. You know, I'm aware of that. And I would do, because I have been the patient, I know what it's like to feel at that stage, to feel no hope, to feel like, look, I'm just losing my freaking marbles here. Like, everyone's saying there's nothing wrong. So for me, like, that's enough. Don't get me wrong, like, I don't probably work the same amount of hours as I once did because, you know, I have a better work-life balance, as they say. You know, in the past, I was like, just work, and nothing else. I'd work, train. That was it. You know, there was no time. But now I suppose I have better balance. And by taking that approach, I don't make the same amount of money, but my life is happier, and I think I do a better job because I'm better in a better capacity to be able to deal with what's coming in every day in front of me, you know.
Yeah, you're very
So I suppose
inspiring.
to follow your passion, like, and like I say to other people, it might not work out. You know, I've been lucky so far. I mean, that could change. Like I said, the powers that be are not going to like my approach. But you know, like if it doesn't work out, like, look, at least you tried. And if whatever you tried didn't work, then you go back to square one and figure out another way to do it. You know, certainly wouldn't say my path has been linear by any means.
Yeah, it's funny, and you probably look back now and you go, it actually wasn't that bad. Like the times where you're coming up, because it's a challenge when you're rising to the ropes. I think that's where when people get to the top, they go, oh, it's a bit boring now. The climb's always the most exciting bit.
Well, you know, to be honest, like 3 years ago when I became very sick, like I lost a lot of my business. You know, I came out of a treatment center, I had nothing because I've been
Mm.
sick for a long time. You know, so it felt like I was starting over, to be honest. So, like I said, I'm not the type of person anymore that like wants to be the most famous person in the world of functional medicine. Really don't. Like, you know, my goal is to help the people that come into me every day. I don't have desires to have 50 different clinics all over the world. It's just not. My goal at the moment, because of the life I've had the first 30 years, is just to be able to enjoy each and every day that comes my way. You know, without wanting, like, just, I don't have need for all these achievements or accolades or anything anymore, by contrast with the past. You know, I think it's a greater gift to me to just be able to enjoy each day as it comes, you know, to be able to enjoy my dog, to do my training, to do my work, but to not be dreading every day. I mean, that's, or let's say that a lot of people, they work all week and then they're just dying for the weekends. For me, like, the weekend, not a big deal. You know, yeah, I don't take clients at the weekend, but it's not a major difference in the flow.
Mm. It's what
You
you
know,
be. No,
yeah,
it's
I think
very
so.
inspiring. Very inspiring. Want you to thank for your time, Fionnula. Absolute amazing. And it's always quality over quantity when it comes to work, isn't it? You find you give a
Exactly.
better service anyway.
And thanks for having me, Sean.
Thank you very much, Fionnula. Have a great day.
You too.